Hello, I'm Valerie Austin. I'm an author, journalist, and hypnotherapist. I'm the author of 7 books, including Self-Hypnosis Made Easy, which was out last year, and you can buy it from Amazon or in the bookshops. In the book, there is a terrific hypnotic suggestion called the orange liquid, which promotes the immune system and release of stress and negativity for anyone listening to this interview. You can get it free on my website, Immune Boost for You, which is the number 4.com. or my Facebook, Valerie Austin, HYP. Welcome to the Cutting Edge Medicine with Hal Blatman, MD. For the many who have chronic pain, whether it is migraine, low back pain, butt pain, or pelvic pain, since it is there, how do you figure out what really causing it and what has to happen to make it go away? The answers are not what we have been taught. Most of the time, it's not the disc, not a pinched nerve, and inflammation is not what we think. My guest today is Dr. Hal Blatman. Dr. Blatman is a board-certified practitioner of integrative and holistic medicine, completed 2 years of training in orthopedic surgery. He later studied ergonomics during his residency in occupational and environmental medicine for American Board of Integrative Holistic Medicine. Lower back pain, what causes it?
You know, you go to the doctor with this pain in your lower back, and you think that the pain is coming from your lower back because that's what you feel it. And the doctor does an X-ray, an MRI scan, and finds a disc and a nerve, or a bulging disc, or this or that, and your pain is attributed to what was seen on the study. Why? Because we were taught when we went to medical school that if we could show some abnormality on a diagnostic test that could reasonably explain something close to where you have the pain, that we could tell you the pain comes from what we see on the X-ray. And that indeed requires a leap of faith we have no right to make. And in many people, you get that surgery and you get better. And in so many more people, you get that surgery and you don't get better, and you're left up with more problems and sometimes a second surgery and a third surgery that also don't seem to help. We have many cases of people with discs that don't have any pain. There was a study done many years ago looking at 100 men, 40 years old, who'd never had any back injuries or never had any back pain, and 30% of them had a herniated disc, and 30% of them had more than one herniated disc. So it doesn't necessarily come from the nerve. And when we teach about pain, we teach the 5 rules of CSI, the 5 rules of how to figure out where the pain comes from, who done it, so to speak. And rule number 1, you cannot believe the pain comes from where you feel it. Your headache doesn't come from your head. The left arm pain could be your heart attack. The pain in your knee probably doesn't come from your knee. Just ask your friends who've had their knee replaced and the knee still hurts. Rule number 2, it's not important what you think the pain feels like. Contrary to everything we've been taught, the brain cannot tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, burning, stabbing. None of those terms are diagnostic, and the difference doesn't indicate a different cause. Rule number 3, the only thing you can believe is that as we examine your body together in the exercise we call physical exam, the places where you are specifically tender, millimeter by millimeter, represent where the strings of fascia that hold you together are tied in a knot, or where they attach and anchor to you and hold you together and you've injured them. And rule number 4, the places where you are most tender as we do that exam represent the injuries through your lifetime, causing most of the pain that you have. And rule number 5, as quickly as you unkink the strings and unkink the cords and heal where you anchor and hold together that you've injured through your lifetime, the pain you thought you had will go away. Low back pain isn't coming from the thing you just did unless you did something really, really big. Most of the lower back pain that people have comes from injuries that started in childhood. How did those injuries happen? Jumping out of trees, jumping down the steps, jumping off the swing set and the monkey bars, and you were either the child that led the other kids, watched the other kids, or followed the other kids off the roof. And so many people remember jumping off the roof. And when you landed, the part of you that got injured were the tendons that hold your butt muscles to your body. And you'll find most everybody with lower back pain, if you touch the muscles in your upper outer butt, they are way more tender than the muscles in your lower back. And if that's the case, most of your lower back pain comes from your butt. You've just heard something very, very different than you've been led to believe for many, many years. So what do you believe? And how do you choose what to believe? And I'd like to say the first thing that I tell people to believe what you can touch and feel. If your butt's more tender than your lower back, most of your lower back pain is coming from your butt. And you cannot talk about this pain without talking about food. If you have a seriously sharp pain that bit you in your lower back and you think it was the Kleenex you bent over to pick up this morning, it was more likely the inflammatory food you ate the night before that glued those muscles in your buttocks and lower back together and increased that inflammatory pain. And you wake up and can't even move to get on and off the commode for a week. That doesn't come from picking up the Kleenex in most people. It comes from the food. So how do you make it go away? Well, you need to unkink the strings in your gluteal muscles, and you need to massage them out. So we talk about the pain patterns to the lower back and the pain patterns that go down the leg that we were taught to call sciatica, that come not from a sciatic nerve, but come instead from that tight, tender kink or knot that you can feel in your butt. And the book talks about how do you take this rubber ball that's a little bit smaller than a tennis ball, put it between your butt and the wall, and just like a bear rubs against a tree, you learn how to massage out that kink in your butt. And as fast as you can do that, you'll find your pain is little bit by little bit better, and that gives you a clue how to make the rest of it go away. If you get the food right and heal the injuries to these tendons that occurred when you were jumping out of trees and jumping off the roof, you'll find that most all your back pain can go away, no matter how many years you've had it. And if you've had a back surgery and your back still hurts and your butt is still tender, this can also help you.
Well, that is fascinating. Thank you so much. It helps on my own back because I have back problems as well, and I'm sure it will help the listeners. And I will, again, buy your book.
You'll find that if you use that rubber ball and do that exercise on your shoulder blades, your arms and hands will feel better. If you do that on your buttocks, you're going to find that your lower back feels better. And in a similar fashion, you're going to be able to use that book to look to see what muscles cause pain in your foot, in your hand, in your neck, in your shoulder, and be able to do something for yourself to make it go away any minute of the day. There's enough words and enough writing to entice the person who's been educated in muscle pain, and there's enough pictures that are so basic that a person who has difficulty reading can learn a lot just from the pictures. Actually, they're not pictures, they're hand-drawn illustrations, so we made sure they say exactly what they need to say.
Well, thank you so much. Pain is not what we're taught. It's not what we think it is. And most of all, it can go away. For more information, you can check out www.blatmanhealthandwellness.com, where you can learn a lot for self-help and get information about Dr. Blatman's Saturday morning talk via Zoom and private sessions. You can also purchase his book, Winner's Guide to Pain Relief, and the rubber ball that goes with it. Great for you to do it yourselfer who wants to get their fascia in better shape and get out of pain. When traveling is allowed, which hopefully be soon, he has the office in New York City and can also see him in Seattle. His main office is in Cincinnati, Ohio, and his telephone number is 844-282-8900. My name is Valerie Austin, and I'd like to hear from you myself. And if you want to find me on my Facebook, it's under Valerie Austin, HYP, or my book is Self-Hypnosis, The Easy Way. And hopefully I'll hear from you. And again, thank you, Dr. Blatman. I've thoroughly enjoyed this interview and look forward to hearing you again.
And thank you so much. It's been so much fun talking to you.